the bone sits kind of like across your body. So it's hard, we can't really get a lateral clavicle. So what we do is an AP and an AP axial. So we're gonna put an angle on our x-ray tube. And then we're gonna do AC joints. So everybody knows the AC joints are out here, right? Now, one of the things that all of you guys are gonna fit on a 14 by 17 landscape. So that's the one thing we're gonna back up to 72 SID so our beam diverges so that we can get both AC joints on the same image. Everybody good with that? You guys have been talking about beam divergence in your exposure class. That's why we back it up to 72 so we can get both joints on one exposure. So we can do 2 exposures of the AC joints. We do 1 without weights and 1 with weights. Everybody good with that? So very simple positioning. The only position I feel is a little bit difficult is the lateral scapula. And you guys have been doing scap-wise shoulders. It's similar to the scap-wise shoulder except for where the humerus is placed. Okay? So, 2 patient identifiers. What are those, guys?
Name and date of birth.
Name and date of birth. If you had somebody whose name was Jane Smith, what are you going to do?
Middle initial.
Middle initial, or maybe a whole full name, just in case we have Jane Smith, Jane Joy Smith, and Janice Smith. You know, do you know what I mean? So we don't have, so you know what that is, because some of those more common names now. If you have Brianna, or that doesn't, that I don't think your name's real common, or my last name. Nobody can say my last name. So those names you probably don't want to ask, but you have a real common name, you probably want to ask the full name. All right, so I have a female patient. What's the other always must-have question? Unless they're 80 years old, if they're pregnant, right? Now, we're still doing extremity work. So what are some questions that we'll ask our patient?
Where the pain's at.
Where the pain is?
How long?
How long?
How'd you do it?
How did you do it? So severity, where the pain is, how long, how did you do it? If they didn't have trauma, we're just still going to ask about the pain, how long they've had it, have they been diagnosed with arthritis, because we do a lot of stuff for arthritis. Not so much, yeah. Usually these ones that we do are all due to trauma. So we're going to go ahead and get started. So good morning, Ellen. My name is Kathy. I'm going to be your radiographer today. I want you to come on in. Now, since we're doing the shoulder girdle, what am I going to have to do for artifacts? I'm going to have her take her necklace off because the AC joints were going to be, her clavicle's right in here, so her necklace would come off. Women have bra straps, so generally I get those people dressed in a gown so that their bra is gone. Does that make sense? So we're going to have her take her bra off. We're going to have her put a gown on, so everything from the waist up off for this image. I had a guy and he was just in a t-shirt, or he's willing to take his shirt off, you know, and he doesn't care if he doesn't have a t-shirt on. As long as I don't have buttons or snaps right in here, I'm good to go. Everybody good with that? Sometimes even some exercise bras, that thick strap will leave an artifact. Does that make sense if they said that, well, I don't have any snaps, but that thickness of the strap will leave an artifact. So we're going to pretend Ellen is all dressed. So, do you have a story for us, Ellen?
I was playing softball and I got tripped by the first baseman and I landed on my right shoulder.
Okay, so where exactly is your pain?
It's here and I have some pain in that
Pain
shoulder
in the
blade.
back?
Yep.
Because as you fell and tripped, somebody tried to steal and they ran over you and
Yep.
stepped on your back?
Yep.
All right, so we're going to be taking several pictures of your right shoulder. And we're going to take 2 pictures of your scapula, 2 of your clavicle, and we're going to take some special views of your AC joint. So we're going to compare both of them. So we'll have 2 of them. So a total of at least at a minimum of 6 images. It should take us about 15 to 20 minutes. Do you have any questions before we start?
Nope.
How'd they do on AIDIT, guys? Did I do okay? All right. So we're going to position her just like we did with the shoulder. I put this in the way, so I have it in the way. We're going to do, if we can do these upright, that's preferred because it's less painful for our patient. she came on a cart, I could do scapula, clavicles, AC joints on a cart, and we'll talk about that in class or on the table, okay? But people with shoulder injuries, if they don't have to get up and down off of the table and they're steady on their feet, it's preferable to do them standing upright. So you said it was your right. Can we make it your left?
Yes, we can.
Okay, sorry. So, if we look at the, if we look at the scapula, is it longer or wider?
Longer.
Longer. So how do you think we're going to put our film in?
Portrait.
Portrait. Okay. So 10 by 12 portrait. Since I'm using the wall bucky, what do I have to be concerned about? Transverse T10. So I already checked. I'm in transverse T10 already. Remember, I can't move my tube. I have to leave it in transverse T10. I'll have to move my patient. Everybody good with that? Remember that? Now what we're going to do for the scapula, we're going to center at our axilla. Does everybody know where the axilla, that is at your armpit. Okay, so armpit, and then we're going to go 2 inches in, so 3 fingers in. So that's where my centering is going to be. And then what I'm going to do for Ellen is, because our scapula right now is the blade, it's really thin, right? And we don't really see it on a chest x-ray when you think about it. Do we ever? But when we do see it, we have them roll the shoulders forward. So how are we going to get this out of the way of the ribs?
Roll them.
But we still want to make it an AP. So what we're going to do is we're going to have Ellen bring her arm out at a 90-degree angle. We call this the pageant queen wave or the stop sign. Which one do you guys prefer? Stop sign? Pageant queen?
Stop sign.
Stop sign. So we're going to have Ellen make a stop sign. So what that does, and I'm a little low now that she put her arm up.
Oh my God.
I'll bring it over a little bit. There we go. Somebody's persistent on our phone.
Mm-hmm.
That's right.
I switched on
The other left. All right. So I got my left marker up above her shoulder. We have a little bit of light above her shoulder. I want to make sure that the inferior angle of the scapula is on my film. Now, this is the tricky part. Now, in some of our digital rooms, we aren't able to do a breathing technique. If we could do a breathing technique in here, I would, I can't really get a breathing technique. So I'm going to use about 11, what do we usually use for an AP shoulder? What do you guys usually use for an AP shoulder?
Just hold still.
Okay. But for a technique. So I'm going to use 80 kVp at 11, like 8 to 12 to 15 mass. Everybody good with that? So I'm going to ask Ellen to take a deep breath in, blow it out, hold her breath, don't breathe. You can breathe. Now, if I could get a breathing technique, what would that breathing technique do for me? It'd blur out the ribs so I can see the scapula. So, Ellen, you can relax your arm. Now, this is the one thing that I'm going to do different from the scap-wide shoulder position. I'm going to have Ellen bring this arm over and put her hand on her opposite shoulder. Everybody's, do we do that for the scap-wide shoulder? No. Now I'm going to have her turn and face the film. We're going to put our shoulder joint right in the middle. What were those two positioning points that we used? AC joint and the scapular spine. Making sure that those are perpendicular. And have you move to your right a little bit. Keep going. Very good. So I've got her head of the humerus right on my positioning line. I'm centering just about at the same spot that I centered for my scapulae shoulder, making sure I have my inferior angle on. I'm going to up my mass to about 20. And I'm going to have her hold her breath. Don't breathe. Good, you can breathe. You can relax. So, what size of image receptor did I use?
10 by 12.
What orientation? Portrait. Because it's longer than it is wide. Now, I'm going to go to the clavicle. What do you think I'm going to do different? I'm still going to use the 10 by 12.
Landscape. I'm
going to put it landscape because now my clavicle goes across the body, right? I didn't try to answer the phone because usually it's some patient calling. Have you ever found out that it's never anybody that wants to talk to us? So I'm still going to be at 40 SID. And this one is really very easy. So we're going to change our collimation to make it 12 length like that and small. And I'm just going to find Ellen's clavicle, and I'm going to put the clavicle right in the middle of my CR. Do you guys see that? So the one that goes this way across, her clavicle's right in the middle of the two lines. Everybody good with that? I want to make sure I have both ends of the clavicle on. So I want to make sure that I have the SC joint, the AC joint on. I'm going to be centered to my film. I'm going to go back to that 10 mass that I used before. And Ellen, I'm just going to have you hold your breath. Don't breathe. You can breathe. Did I worry about where her hand was? Did I? This one is a neutral rotation hand again. So I'm not worried about how the humeral head looks. Now, the next one we're going to do is an axial. So I'm going to roll my tube 15 degrees. So from 90, that'd be 105. And once again, sorry, Ellen, if I got that in your face. I'm going to center my CR right on my clavicle. The only tricky part is you got to remember to pull your film out and center to your IR. Okay, that's the one thing people forget. Once they angle, they forget to move their bucky. Okay, so remember you got to center your bucky. I'm going to use the same technique. I haven't put that much of an angle on it. Once again, Ellen, I need you to hold your breath. Don't breathe. Good, you can breathe. That was the clavicle. Very easy, right? 2 projections. Patient doesn't move. Only thing I did was angle my tube. Everybody good with that? Mm-hmm. Now I'm going to go to do the AC joints. We're almost done, Ellen. We got those special pictures of your joints to do. You guys remember what I said I was going to do with them? I'm going to try to get both AC joints on the same one. So since I want both, people are wide, I'm going to go to a 14 by 17 landscape. Okay? I'm going to take the angle off of my tube. And remember we talked about the beam divergence, so I'm going to back up my tube to 72. Now when I back up my tube to 72, what is that? I wanted the beam divergence, but what does that do to the intensity of my X-ray beam?
Lessens it.
It decreases it, right? So if I can do a shoulder at 10 mass at 40, what do you think I need to do to my mass when I
Double it.
double it? That's a pretty standard thing. So we're going to use 20 mass at 80. Does that make sense? Because of the increased distance. Everybody good with that? So for this first one, I'm going to have Ellen stand with a neutral position. I'm going to center 1 inch above her jugular notch. Remember we found jugular notch when we did the AP cart chest? So 1 inch, which is about 2 fingers above. And when I do that, my crosshairs should be going right through her AC joint. Does that make sense? So that's kind of how I gauge that. So left, and I put my right there. That's a good one. So when you do bilateral, you want to put both markers on, left and right. I'm going to collimate to, what do you guys say? This is about a 5 to 6 inch in length. So I have our AC joint, I have my markers on, her hands are in a neutral position. I have her centered in the middle of my film, both joints are on. I'm going to double my mass. And Ellen, I need you to hold still, hold your breath, don't breathe. Good, you can breathe. I'm going to change my film out. And I didn't get my markers Bradley beforehand. I'm going to find the marker that says with weights. Maybe it's on mine. Weight bearing. That one's close enough. I'm going to leave my mass alone. The only thing different I'm going to do with this one is add a weight bearing marker. And I'm going to give my patient, and one of the things I'm going to want to do before I give the patient some weights is to make sure there is not a fractured clavicle or shoulder. Does that make sense? Usually when I've done AC joints, I've already done their shoulder, I've done their clavicle, and they've been negative. But if they just come in for AC joints, you want to do the non-weight bearing first. Take a look to make sure there's no obvious fractures before you give them these weights, okay? I'm going to ask my patient to just put them around their wrist like this and let the weights pull down on their joints, okay? I got everything set up. I'm going to put the weights around your wrist here. We're going to put some weight on. Just hold still, hold your breath, don't move. Good. I'm going to come take the weights away right away. And that's it.